Hello, welcome to Advancing Health Literacy, Improving Written Communication for Social Care Settings. This is the second in a series of trainings brought to you by the New Haven HEAL Initiative. The New Haven HEAL Initiative aims to improve health outcomes for New Haven residents, to reduce COVID-related disparities, and to increase patient engagement in their healthcare. To refresh your memory, health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. In the last training, we went over how to form a health literacy team, how to create a plan, raising awareness, clear communication, the teach back method, following up with residents, improving your telephone system, brown bag reviews, addressing language differences, and considering culture, customs, and beliefs. If you look at the poster on the right, you'll see a pretty old example of how health information used to be communicated to the public. We've come a long way since then, and today there are a number of strategies that can be used when creating health messaging. During today's training, we'll be going over a few tools you can use to improve written communication at your organization. Tool number 11 is assessing, selecting, and creating easy to understand materials. Agencies often ask residents to fill out forms or provide them with written materials to read. With 36% of the US adult population having limited health literacy skills, it is likely that many residents don't understand all of the written materials they receive. Assessing, selecting, and creating easy to understand forms and educational materials can help you improve resident comprehension. Start by training a staff member to evaluate the quality of materials you give to residents. Have at least one person in your practice learn to assess the materials you distribute. Focus first on important and frequently used materials. Be sure to review materials developed by your practice, as well as materials obtained from outside sources. Assess whether resident materials are easy to understand and read. There are numerous methods for assessing resident materials. Some approaches focus on how readable the materials are. Others examine a broad array of features that can make materials easy to understand. You should use both types of methods in assessing your materials. Readability formulas focus on the length of the words and sentences in a document and provide an estimate of how difficult text is to read. Several websites are available for conducting readability assessments using commonly used formulas. In most cases, these sites indicate the grade level at which a patient would have to read to understand the material. The average adult reads at the 8th or ninth grade level, and 20% read at the 5th grade level or below. Therefore, to ensure wide understanding, it is best for materials to be written at the 5th or 6th grade level. Search the internet for readability formulas to find free online resources. Several methods are available to examine features of resident materials other than readability that affect understanding. AHRQ's Patient Education Materials Assessment Tool can help you assess written and audiovisual resident education materials. It provides separate measures of how easy materials are to understand and to act on. The CDC's Clear Communication Index assesses the clarity and ease of use of written materials, particularly those with behavioral recommendations or those that communicate information about risk. The Suitability Assessment of Materials assesses the suitability of health information materials, including how well materials stimulate learning and how culturally appropriate they are. Ask residents to evaluate your forms and other written materials that you hand out or are available online. Include both materials that you developed and those you obtained from external resources. Watch out for numbers. Ensure that your materials follow recommendations for improving communication of health-related numbers. Provide only the information residents must have to make informed decisions. Provide residents with numbers, not just verbal descriptors such as low risk. Remember to use simple graphics to express numbers. Choose or make materials that are easy to understand. Identify poor quality materials. Identify materials that performed poorly on your assessment. Working with your health literacy team, consider whether these materials can be modified or whether they will need to be replaced. Select better materials. When you identify deficient materials that cannot be revised, search for new ones. Consider alternatives to written materials. As 1/5 of adults read below the 5th grade level, it is best not to rely too heavily on the written word. Audio and video resources, as well as talking in plain language, may be better for many patients. Use the internet. There are many free health educational resources available on the web which contain interactive tutorials. Assess all new materials using the tools mentioned above. When directing residents to a website, be sure it has simple navigation and is easy to read and understand. Provide materials in languages your patients speak. Making easy to understand materials available to your non-English speaking residents can be helpful. Keep in mind that some residents with limited English proficiency may also have limited literacy in their native language, so make sure you consider alternatives to written materials. Create new materials to fill gaps and revise homegrown materials that need improvement. Sometimes you just can't find easy to understand instructions or information you want to share with your residents. Or you realize that the materials your office has created are not as easy to understand as you'd like. Use existing guides to help you design or revise materials and websites so that they are easy to understand. Streamline forms. Make sure forms ask for only information that you absolutely have to have and ask for it only once. Involve residents. Invite residents to contribute to the development of new materials. They're the experts on what information is important to them and what makes sense. Consult on legal issues. When using a form for a legally binding purpose, consult a lawyer for legal advice. Obtain approvals. Some agencies may need administrative approval to revise or replace written materials. As always, track your progress. Tool number 12 is using health education material effectively. Health materials are effective only when used as part of an overall resident education strategy. Simply handing residents a pamphlet or referring them to a website is not enough to promote understanding or behavior change. Don't assume that your residents read the materials you give them or direct them to. If the information is critical, make sure you or someone in your office reviews the information with your resident and or the resident's caregiver. When reviewing a handout, circle or highlight the most important points as you talk about them. Personalize the material by adding the resident's name and or specific instructions. Use the teach-back method to confirm understanding. Emphasize the importance of the material by referring to it during follow-up phone calls, emails, and future visits. You may need to give the material to the resident more than once. Ensure residents know how to use audio-visual materials or access the internet. If you give residents DVDs or refer them to websites, make sure that they have the appropriate video equipment, internet access, and the know-how to view or access these materials. Like written materials, you can't assume that your patients will view audio-visual materials or visit websites you recommend. If the content is critical, be sure it gets communicated in person. Always have a conversation with residents after they view audio-visual materials. Decision aids and tutorials can save time but are a supplement to, not a substitute for, a discussion and checking understanding. Train residents to use websites and online portals and to be discerning consumers of internet content. Even residents with excellent health literacy skills may have limited computer skills. To ensure that residents are able to access your online portal, arrange training sessions to show residents how to get online and retrieve information from the portal. If residents are surfing the internet for medical information on their own, you may want to educate them on how to find accurate health information. Obtain resident feedback on materials. When following up with residents, ask whether they found the materials helpful. This can allow you to emphasize the importance of the materials, review any questions they may have, and obtain input from the resident about the materials provided. Manage educational materials. Monitor and organize any materials you distribute regularly to ensure you know the type and amount of materials you have, can easily locate them, and know when you need to update or restock them. Update your list of easy to understand materials available through your online portal. What is available may change rapidly. If materials are accessed via hyperlinks, check frequently to confirm that the hyperlinks still work. Create an information order set. Have someone in your office assess electronically stored materials and identify the best ones. Then create information order sets for commonly used materials. For example, you may want to create an order set of materials for residents who are newly diagnosed with any chronic conditions or illness, or who are starting new treatment. Order sets can also be made available through an online portal. Ensure staff know what educational materials are available, where they are located both physically and or online, and how to use them effectively. Remind staff on a quarterly basis. Remember to track your progress. Tool number 13 is welcoming residents. Do your residents feel welcome when they enter your office? Have you clearly identified how to get to common locations like the restroom or the checkout desk? Do residents face a barrage of paperwork when they first come in? Some residents may feel anxious or intimidated when navigating an office. This may be more problematic for new residents and for those with limited health literacy. Creating a friendly and easy to navigate environment may help your residents feel welcome and relaxed. First, assess your office. Shadow residents or conduct a walkthrough. Review signs throughout your office. Check to make sure there is a review and approval process for changing signs in your office. Look at all of the signs in your office and make sure they are easy and visible to understand. Provide clear direction. Use signs to identify and direct residents to common locations, such as the practice office, the check-in and check-out areas, rooms, and restrooms. Make sure signs are written in appropriate languages and use graphics when appropriate. Consider other approaches to help residents find their way, such as color-coded lines on the floors or walls. Train staff. First impressions count. The first person a resident talks to should be helpful and cheerful. Use the guidance in this tool to train front desk staff on how to create a helpful and health literacy friendly atmosphere for your residents. Don't forget the back office. Residents with billing questions often find it difficult to understand procedure codes or insurance practices. Teach your staff to provide easy to understand explanations of common billing concepts that avoid technical jargon. See the tools on raising awareness, communicating clearly, and improving telephone access for additional guidance on training staff. Offer everyone help with forms. You can't tell by looking which residents may need assistance, so offer all residents help with the forms that they are asked to fill out or sign. Offer help in a friendly, non stigmatizing way. You can also refer back to tool number 9 for additional guidance. Assess language preferences. Ask patients about their language preferences and provide appropriate language assistance services. Create an office brochure. Be sure to highlight key elements of your office, such as contact information, including after hours and emergency information, services provided, the address and directions to your office, and what to bring to appointments. Use the waiting room to display important information. Use the space in your waiting room to share important information, but don't overwhelm patients with too much material on walls or tables. Display posters to raise awareness about your office's quality improvement work and to educate residents about important concepts, such as the importance of asking questions and the importance of reviewing and remembering to take appropriate medicines regularly and correctly. Display photos of office staff, including names, titles, and key responsibilities to help residents better understand the roles different staff members play. Use bulletin boards as focal points in your lobby to arouse resident interest, stimulate thought, and encourage action. Provide easy to understand resident educational materials. Make sure written resident educational materials in your waiting room are easy to read and understand. Rather than providing numerous pamphlets, select those materials that are most relevant to your residents' population. Use video and television programming. If you have a television in your waiting room, use it to show easy to understand health-related information. Ensure that all the materials displayed in your waiting room are targeted at your audience, organized around a central theme containing no more than 4 points of interest, easy to understand and colorful, and updated regularly. Assign staff to update the content on a regular basis. This concludes today's training on improving written communication. Be sure to try these tools out. This training is brought to you by the New Haven Health Education and Literacy Initiative, led by the New Haven Health Department. Join us for our next training coming soon on improving self-management and empowerment.